So yesterday we talked about temperament, lymphatic temperament. Today we will discuss about sanguine temperament. So basically lymphatic temperament, the organs which produce lymph, the organs which utilize lymph, the organs which purify lymph are very important. If we diagnose the patient, if he belongs to lymphatic temperament by the help of the things which I described yesterday, okay, like facial look, eating habits, and walking style, okay, it will give nearest image of the patient if he belongs to lymphatic temperament. Okay, first thing. Second thing is that it may be directly these three steps are involved. It may be affected lymphatic making organs, lymphatic utilizing organs, lymphatic purifying organs. Okay. So whatever medicines you select, depending upon the condition, it will give the you wonderful result because you are working on the temperament. Okay. So let's hope that we diagnose very well by this method. Okay. And we have another method also that is pulse diagnosis. Okay. Based upon this lymphatic temperament, we also diagnose the patient belongs to which temperament. Okay. In coming classes, I will help you how to do pulse diagnosis. Okay. So let's continue. Today's class that is sanguine temperament. So basically in the sanguine temperament, we have three steps. That is the sanguine means blood temperament, the organs which makes blood, the organs which utilize blood, the organs which purifies blood. So in the sanguine temperament, the the patient or the person's blood is more dominating. Okay, blood is dominating. In the lymphatic temperament, the dominating liquid is lymph. In the sanguine temperament, the dominating liquid is blood. So this is the thing we have to remember, which is dominant. If the dominating thing is the we can decide that this person belongs to those temperament. Okay, that's the reason we will call sanguine temperament. And the person have white the persons will get the diseases due to the whitation of blood. Mostly 80 to 90% cases he will have blood related disorders. Why? Because the sanguine temperament related organs are activated. So that's the reason he will get the diseases related to blood, blood making organs related diseases, blood utilizing organs diseases, or blood purifying organ related diseases. So like example, I will give you that the person will came with you with SOB, shortness of breath. He is telling that while walking, I am getting SOB. While sitting, I am okay. Okay. So he came to your clinic and you ask all the things related to his temperament, what you eat. Please show me how you are walking. Okay. You saw his hair, his eyes, his nose, everything, and you ask about eating habits, then you diagnosed as is related to the sanguine temperament. Then what you will do, you will check with the pulse. The same thing you asked and you diagnosed, same thing you will you will check in the pulse. And again that you will get the only organ which is involved in these things you will get in the pulse. So we have to relate it. We have to correlate with the facial, nose, everything related with the pulse. Then you will focus on that. He belongs to sanguine temperament. Then you have to check those points related to the sanguine temperament in the pulse. Okay, so come to the class here. So what are the organs which makes blood? This is very, very important because diseases will start from here only. If he belongs to sanguine temperament, so diseases will start from here only because the factory is not good, then the product is also not good. Okay, so what we have to do, we have to clean the factory, we have to repair the factory, we have to put new instruments in the factory. Then you will, the end result, whatever product you will get very genuine product, quality product. Okay, so what are the blood making organs in the body? We have two organs. The one is liver and another one is bone marrow. So metabolism which occurs in the body is within the liver. All types of metabolism. So there is the reason we selected liver and bone marrow. It is the main area where blood is produced. All types of blood we already studied in anatomy and physiology that bone marrow have stem cell. Okay? One stem cell will produce another cell will produce identical or different types of cells. From that, we will get end product RBC, WBC, platelets, and lymphocytes, erythrocytes, whatever may be. Okay, so this is the process. Okay, if the bone marrow is not good, what will happen? We will get unmatured cells which will get into the blood. Then what happened? Early, the blood cells cannot reach to the area of the organs. Then what will happen? Then they will get degeneration because lack of oxygen will reach, lack of nutrition will doesn't reach to the area of the organs, and degeneration will happen. So what we have to do? We have to repair the bone marrow. Nowadays, number of patients have leukemia, and they have infection and they need bone marrow transplantation. Why? Because the blood is not produced what they need. How? What type of quality they need? The production of the blood is not happening. And the liver, nowadays, number of patients have liver disorders, fatty liver, okay, cirrhosis of liver, okay, hepatitis, jaundice, okay, these all types of diseases are seen. And the another reason is food habit. If you eat the food which is not good for your health, especially it will damage initial organs like stomach. You will get acidity, you will get all types of indigestion problem. Then you have small intestine issues. Then you have constipation. Then those things will reach to the liver and it will also damage liver. So nowadays, digestive issues are very, very common. Okay, so you have to treat first. So then what organs will utilize or blood? Like heart. Heart is the main pumping organ of the blood. Arteries, veins, capillaries, and muscular system, nervous system. Okay, these are the organs which utilize blood. And other, we have heart, okay, arteries, nervous system, muscular system, everything will utilize. Every organ need blood basically. But here, what we can tell here that all body organs utilize blood. Basically, blood have all the nutrients, all the products which need by the organ. Sugar, proteins, nutrients, oxygen. Okay, everything is there. Minerals, okay, everything is present in the blood. So basically, so these organs are the main utilizing organs of the body. Okay, muscular system, everything need circulation. You are talking, you are walking, you are eating, you are writing, you are doing something with the help of muscular skeletal system. Nervous system is always activate, so that's the reason it need blood. Capillaries, veins, arteries, heart, they are doing their work 24 into 7. 24 into 7. So they need more blood. Okay, so there is the reason we are selected these organs, not all the organs. They are utilizing, but when they required. Okay, here we have the organs which purify the blood. So we already know that lungs and kidneys, very, very important. Okay, also kidney have one hormone, erythropoietin, okay, which helps to uh, production of blood. So there is the reason I have selected kidney here also. Blood, blood, lungs will purify the blood. How? Because deoxygenated blood, which is present in the blood, deoxygenated, deoxygenated blood, okay, which is present in the blood, will go through outside with the help of lungs. We expirate and we inspirate oxygen. We expirate carbon dioxide and we inspirate oxygen. So with the help of lungs only. Next are kidneys because of the we already studied in the urinary system that blood will reach to the kidneys. Okay, daily 1,000 liters or 3,000, 1,200 or something amount of blood will reach to the kidney and it will purify. It will release all the waste materials like urea, creatinine, everything which doesn't need by the body. Okay, so it will come out through the urine and we will urinate every day and we will release all the waste products from the body. So blood. So the problem maybe comes in the beginning, middle, or end. If the beginning is not good, end is also not good sometimes. If the problem is in liver or bone marrow, the same problem will circulate in the blood. The same problems will reach to the organs. The problems which are present in the beginning will also reach to the end because they have more stress to purify the blood, to purify the blood. Okay, so these things we have to remember. So what are the organs? Let's see. This is capillaries, arteries, veins, blood cells. You can see the liver, largest organ. We have the bone marrow, okay, and we have the kidney, okay. So let's see how a person, sanguine temperament person will look. We have light hair, eyes, light hair and eyes, smooth skin, and red in color, bright red in color, bright red in color, and he is fair, okay, and mucus lips also, or bright in color, mostly throat, tongue, and conjunctiva in the eye also red in color. Okay, and internally he has strong pulse, rapid digestion. Okay, and hotness in the limbs. Okay, and they are acidic in nature because mode of the circulatory system is activated. So there is the reason all these things you can see rapid digestion, rapid circulation. Okay, these are the complex and internal things you have to ask the patient. Okay, now you can observe other hints, how he walk, how what are the face look, eating habits, and normal character, or we can see that you can see that what can I guess say you that emotions. What type of emotions you have? Normal character or emotions. Walk. So already I told you that. Let's first here we can see that then after we will see. We have the palm. This is the foot region. So yesterday we told you that the person belongs to the lymphatic temperament will kept his heel first, then foot. First, but here Senguine temperament will put his foot first, then heel. His walk like that. First foot, then heel. 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 You observe most of the person walk like this. So you can, if you observe his shoes, front part of the heel is most rapid. Okay. So this is the walking style. Second is that if you see his face, what how he looks, his nose is straight, non-bridge. Okay, and tip of the nose is sharp. The tip of the nose is sharp. So person mixed temperament. We will talk later. First, you can get uh, so tip of the note is sharp. Okay, and if he smile, what will happen? The cheek will above than eyebrow. Eyebrow. Okay, you can see that. Okay, if he smiles. First thing is that he walks. He foot his foot is first and second heel. Second is non-bridge and sharp nose. And cheeks are above than the eyebrow. Okay, these are the things we have to remember. And eating habits, very, very important. He 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 want to eat spicy food. Okay. And non-veg is he want to eat non-veg. Most of the people, not all people, some people doesn't eat spicy food, even though they have this character. So we have to pass them vision, these things. And his emotions, normal character, how he can mingle with anyone. Okay. And he is most talkative and he will got he angry easily, even though he will sometimes he will hit others. Okay. And if you talk politely, then easily his anger decrease. Okay. And he's hypersensitive. He doesn't stay at one place for more than 1 hour towards. Okay. He want to do something is going in his body. Okay, so we see number of persons. Most of these characters we see in children. Okay, because uh, they are in the growth stage. In that period, liver and gallbladder are activated. So this is the reason. That is the reason they are in the sanguine period. I will tell them they are in the sanguine period. Most of the uh, babies. Okay, child. Okay, so these are the normal characters. So what are the types of diseases they will get in the future or mostly? So understood this topic very, very important because with this simple steps, you can easily diagnose he belongs to sanguine temperament or lymphatic temperament. Okay, first heel, then first foot, then heel. First thing, second is no non-bridge and nose is tip of the nose is sharp and cheeks are above than eyebrow. And he want to eat spicy food, non-veg mostly, and he will mingle with anyone, talkative, and he will got easily angry and easily his anger is decreased and hypersensitive. So what type of diseases they will get? They will get the bleeding type of diseases. Most of the person have bleeding nose, ringing in the ears. This is not singing, ringing in the ears. Okay, bleeding piles, constipation, vertigo, palpitation. Okay, inflammation of throat, chest problems, intestine, because digestive system is most activated. So he want to eat more spicy food. So what he will get? He will get digestive issues. Okay, hypertension. Okay, cerebrovascular accident in the brain. They have bleed, hypertension, kidney issues. lungs issues, heart issues, artery issues, veins issues, muscular musculoskeletal problems, nervous system problems. Okay, and his blood and urine are acidic. So what he need alkaline type of food. So it will balance his body. What in female you can get that uh, the menses will have more blood and early, mostly early or quantitative blood. You can see that. So in children, constipation, fever, cold, and cough, we can see that. So all these things we can see in the sanguine temperament patients. So what type of medicine you have to give? So you have add angiotensin. So A blood group, A sorry, A group will help this persons. So if A1 also A2 A3, if you have to give the patient first. Mostly A3 is advisable. If A3 is not suitable, you can add A2. A2 also is not suitable, then A1. So this is for you. Then we discuss the plans and everything. You can correlate those plans to the patient and you can adjust the medicine or remedy. And S1 maybe give hyperactivity of symptoms. We cannot use aggravation, okay, according to Dr. Sanjeev Sharma sir, because this term is related to the homeo. Homeo medicines will give aggravation, but electrohomeopathy medicines it will increase the symptoms, hyperactivity of symptoms. What we tell if a patient have if you give one medicine, electrohomeopathy medicine, the symptoms are increased. What do you tell? That hypersensitive, hyperactivity of symptoms. The symptoms are erased, symptoms are increased. After 10 to 15 minutes, everything will be normal. But in homeopathy, that will not happen. It will take longer duration, or else you have to take another medication. Okay. So mostly A3, you have to select A3. If A3 is giving uh, hyperactivity of symptoms, then the patient belong to lymphatic temperament. Okay, that is very important. Now to remember. Or else, one thing you can do that if a person came to your clinic, please make three things: S1, A3, L1, F1 also. If he's lymphatic, give S1 and L1. If he's sanguine, give A3. If he mixed temperament, give F1. If he is tolerated, means that the person belongs to same temperament. If he is not tolerated, five things you have to remember. After mixed temperament, I will tell you about that. What things you have to notice during after giving these remedies. If the sanguine temperament came to a clinic, you gave A3. If the symptoms hyperactivated, then things that he is not belongs to sanguine temperament. He belongs to lymphatic or mixed temperament. Then again you have to change to L1 S1. Again, if the symptoms hyperactivated, you can give F1. If F1 is well tolerated, means he is mixed temperament. So likewise, you have to practice, then you will get the things what you want. Okay. So I hope you understood about uh, sanguine temperament, which is very, very important and interested. Okay. So we will talk about mixed temperament in coming classes. Okay. Thank you. If any doubts, then please clarify.